Hi again YouTube. In today's episode I'm going to talk about how to fix lower back pain.
So as we're talking about back pain today, I'm going to go for a quick back session, so if you need any ideas and you want to steal some, feel free.
Okay, welcome to vlog number 3. Today I'm going to go through a lower back pain fix. I hope if you do have a lower back pain problem, this can help you. Okay, so there's many reasons people have lower back pain. It could be the fact they injured themselves, it could be the way that they work, if they sit down a lot all day, or it could be a genetic problem. There's many reasons why people could have a lower back pain, but it seems to be the most common injury or the most common bother across society these days. So today I'm going to show you how to correct it, how to rehab it yourself so you end up having less problems with your back. 99% of lower back problems can be fixed by fixing your muscular imbalance. Now the muscular imbalance that you have starts in the hip region. If you imagine the middle of your body where your hips and your core are, that's where everything progresses from. So if you've got shin splints, if you've got flat feet, if you've got hypolordosis, or you've got a pelvic tilt, it's all coming from the middle of your body. Anything that happens in the middle will throw out anything up top and anything at the bottom. So if you go to the doctors with a flat foot problem, they'll give you insoles, but what they don't understand is that the problem's coming from your hips. It's the fact that you've got a hip tilt and it's pushing your knees out the wrong way or in the wrong way, which is then making your feet overpronate, for example, and that's what's causing you to lose the arches in your feet. So as you can see on the drawing here, I do apologise if it's too small, most people with a hypolordosis have a huge curve in their lower back, which makes them look like they've got the gut sticking out and the bum sticking out the other way. If you've seen Paul Chek's videos before, he talks about this as the Donald Duck syndrome. If you can imagine the duck with its chest out, belly out, and its butt sticking out and it waddles along. Now if you've got someone with a serious hypolordosis, it's very obvious to see. The reason these people get this problem is because their hips are tilting forwards. As you imagine, if the hips are here, tilting forwards, it's bringing the belly forwards. It's then tilting, so the back of the hips are then pushing the glutes out, the ass out. So you've got this huge S-shaped problem. Now the reason this happens is because of a muscular imbalance on a lower cross syndrome, and I'll explain that now. I'm just gonna make this diagram bigger, better. So abs here, lower back here, hip flexors here, and glutes here. Now the problem with people with hypolordosis is that they're too strong on one side of the lower cross. Now your muscles cross around your hips and it's called the lower cross. Okay, so the muscles work synergistically together. So the abs are attached through to the glutes, okay? And the lower back is attached straight through to the hip flexors. These muscles work as a pair and as a team. Now what happens when you have hypolordosis and an anterior tilt is one pair of muscles are too strong and they start to tilt the hips forward. So with the people that suffer from hypolordosis always having a lower back problem, is purely because their abs are too weak and the glutes are too weak. Their hip flexors are too strong and the lower back is too strong. So if you ever go to a physio and he tells you, if you've got hypolordosis, and he tells you you need to strengthen your back, he's completely wrong and he has no idea what he's talking about. Okay, so what you need to do to fix this issue is to strengthen your abs and to strengthen your glutes, okay? So this cross going through here, these two muscles need working on as your other muscles are too strong and they're doing all the exercise. Imagine that your core is supposed to stabilize you, but your abs are too weak to do that and your back's too strong, so your back's doing everything that your core does. So every time you're trying to do a leg raise, every time you're trying to do a clean and press, for example, instead of your core keeping your body straight and strengthening it from the middle, your back's doing all the work, which is then going to cause, obviously, back pain. So as you can see here, if we were to rehab, strengthen the abs and strengthen the glutes, it would then pull the hips from being tilted forwards here, bringing them back round for a straighter body and a more neutral hip placement. So you should stay away from trying to strengthen the back. Although you think that your back's weak and a doctor may have told you or a physio may have told you that your back is weak, it's not, it's too strong. So stay away from doing deadlifts or any sort of lower back exercises. What you need to do also is to stretch off your hip flexors and stretch off your lower back. Work on your glutes, activating glutes by doing glute bridges squats, and work on your core, any sort of leg raises, crunches, plank, any sort of core exercises. This is when people have no curvature in your spine. You're very straight from head to back to lower back into legs. You do see these people that look like their back just joins into their legs and they've got no sort of glutes, no sort of bum whatsoever. Now these people have this problem because they have a weak lower back and weak hip flexors, the exact opposite to hypolordosis. As they have a weak lower back and weak hip flexors, they then have tight glutes or strong glutes and strong abs. So avoid doing extra crunches. This is not going to help you. Okay, you need to strengthen your hip flexors and you need to strengthen your lower back, deadlifts, hyperextensions, etc, etc. Again, to fix hypolordosis, you need to strengthen your lower back and your hip flexors, okay, to then pull the hips back into a neutral position. Okay, there is two other skeletal back problems, one being kyphosis and the other being scoliosis. Now scoliosis looks like this. So if you're looking at the spine from the back, it's bent round in an S shape. That is to do with muscular imbalances, but it's an extremely difficult one to fix, all right? Definitely worth seeing a chiropractor or an osteopath if you've got scoliosis. And kyphosis, which looks like this, where there's a huge bend, a curvature in the upper spine. So the best way to fix kyphosis is to strengthen your back muscles, okay? So it then pulls your spine back round into a more neutral position, okay? So people with kyphosis looking like this, strengthen your back muscles and you'll eventually neutralize your spine. So I hope that helps you out. Either hyper or hypolordosis are the two most common back problems. Fix the imbalances and it will eventually bring the tilt of the pelvis from being an either posterior or anterior into a more neutral position by strengthening one of the lower crosses. Okay, so I hope that explained everything. If you've got any questions, just direct message me anywhere, Instagram, Facebook, on YouTube, and I'll try and help you out wherever I can. Don't forget to like, subscribe, because I'll be uploading videos every single week.